Hello, this is Dr. Aanchal Panth, and today I'll be sharing the journey of a patient who underwent hair transplantation 6 months back. A 42-year-old patient visited us with grade 6 baldness. He had hair loss starting from the frontal area right up to his crown. His lateral humps have also thinned out, and his crown is completely bald. This is his side profile, and this is how his beard looked at baseline. In the first session, we planted 4,700 grafts in him, out of which 2,600 were taken from the scalp and remaining were from this beard. In the first session, we hadn't covered his crown area at all. This is how he looked after 3 weeks from the procedure. As you can see, we have completed the front area, but his crown looks quite empty. We then did his second session after 3 weeks. In this session, we planted about 1445 grafts. We had taken about 400 grafts from the scalp and remaining were from the beard. This is how he looked after 10 weeks from the first session. You can see that there are few hair growing, but he has also shed a lot of hair that were planted. This is a very normal process. The hair that we plant do shed in about 2 to 3 weeks, and the new hair growth can be appreciated in about 3 months. This is how he looked after 4 months. You can see that there is a little bit of hair growth, but still the white spaces and the hair looks very scanty. This is when the patients tend to get a little impatient about the outcome of hair transplantation. So we must explain to them that it's a natural process and it does take 6 months for good results to be appreciated. This is how he looked in about 5 months. The existing hair has become thick and there is a bit of a coverage that can be noticed now. At 6 months, there's a remarkable improvement from baseline. He has good hair, good density, proper texture. The results look very natural. It has merged well with his existing hair. The crown, however, is still a bit scanty. The hairline looks seamless, natural. There are no bumps or pits. It merges very well with the rest of the hair. We've used single follicular units to create the hairline in order to give a very natural finish. These are the pictures comparing his results with baseline. The density is really good. It has completely changed his look. The texture of the hair also looks good. It has merged well, but the crown remains slightly scanty. After a few months, if he wishes, we can definitely harvest more hair from the back and the beard and cover his crown in order to give better density. I always like to explain to patients who do not have very high density in the donor area that our first priority will always be the front. We will always want the best result in the front, and whatever remaining grafts are there, we plant it in the crown. So if you have thin hair at the back, thin donor area, then crown will remain slightly scanty even after hair transplantation. You can see what a remarkable change hair transplantation can bring to the overall look of the patient when done correctly. I hope you found this video useful. For more videos like this, kindly subscribe to the channel.